Hi, I'm Dr. Brad Morris. Today I want to talk to you about knee pain. First, a little bit about myself. I am a board-certified chiropractic physician. I've been in practice over the last 15 years. I did write a book called Pain is Not a Lifestyle, and I'm a member of the International Association of Functional Neurology and Rehabilitation. Knee pain, I did create a program called the 4-Point Knee Therapy Program. About knees, there are other options out there besides knee replacement surgery, even if your knees are bone on bone. And all knee replacements don't work 100%. It's not a simple surgery. There is a high risk of infection, and unfortunately, knee replacements wear out. What we do first is we want to do a knee examination. We're going to check 4 muscles and 2 tendons and large diameter afferents. Those LDAs, or large diameter afferents, are pain fibers which inhibit or prevent pain. They fire into the spinal cord in what's called lamina 2. What we're going to test for, though, is we're going to look for point tenderness and muscle strength in those muscles. Of those 4 muscles, we're going to use the popliteus, which is a small muscle that's right behind your knee. We're also going to check the adductors. It's a muscle that's on the inside of your leg. The TFL, or tensor fasciae lata, is a muscle right here above your hip. And the psoas muscle. That psoas muscle connects to your spine and down to your hip. It actually starts at T12 and goes all the way through the lumbar spine and then down to the hip. And that's what ties that leg into that spine. On the tendons, above the kneecap there's a quadricep tendon, and then below the knee there is an infrapatellar tendon. So we want to check that to make sure that there's no point tenderness and that all those muscles are strong. The LDAs, or large diameter afferent fibers, again, those fibers, they fire into the brain, and that's how we inhibit pain. And when we have a problem with these fibers, what happens is that person suffers with chronic pain. Okay? With our therapy and our program, what we expect is to see results in 1 to 3 visits. Now, how do we do that? Well, one of the things that we do is laser therapy. Now, laser therapy, what that's going to do is going to promote cell growth and promote healing. So we'll be able to get the inflammation out of the area quickly, as well as try to get that tissue to heal. The second thing that we use is called HOCOmed, and it's horizontal therapy. What it is, it's a bioelectrical and a biochemical process to come in there and reset the way that brain communicates with the body. It's really nice because it does both things at one time instead of being able to do one at a time. It does improve the cells with the biochemical effect, so we're actually healing that tissue. The next thing that we do is called scar tissue therapy. And so what we got to do there is we got to get in there and break up those adhesions. Anytime you've had any trauma or any chronic pain like that, the body lays down the scar tissue to try and protect the joint and protect the muscle. So we got to get in there and break up those adhesions so that that muscle will work more freely and get you out of pain. We use what's called a vibrocussor on that, and what that vibrocussor does is it has a frequency that's known as a tonic vibration reflex. This frequency is well known to instantly relax muscles. It blocks against guarding, cramps, and spasms. It's unique above properties as it operates many times faster than other therapeutic devices. It also feels great. The next thing we use is called pulsed electromagnetic field therapy. Now, what that is, it generates a magnetic field that many find beneficial for supporting the body's natural healing ability. It directly affects the system responsible for the healing. There's no healing, repair, or growth that takes place in the body without signals or electrical impulses sent by the central and peripheral nervous systems. PMF directly impacts that nervous system. It's also been found to induce GABA. That's an inhibitory neurotransmitter that calms and relaxes in certain parts of the brain. And when the body relaxes, the parasympathetic nervous system takes control, and then the body can start to continue to its natural healing ability. PMF's also been proven to relieve pain by increasing endorphins. There's more energy via ATP, nerve and tissue regeneration, improved immunity, allows for better oxygenation and circulation, better sleep, and HGH, or human growth hormone. It also has relaxation and stress reduction, and it builds stronger bones. So PMF is a great tool to put in the program. So all 4 of those things are what we use to eliminate pain. We've been quite successful at it.